We want to get in some perspective now from the Kenya Medical Practioners and Dentists Board. And the CEO of that, Daniel Yumbya, joins us this afternoon to discuss this. Daniel, thank you very much for joining us. Of course, this discussion coming on the back of your conference that starts next week, we'll get into that. But top on Kenyans' minds today is, the health crisis across 8 counties. What are your thoughts on that? I don't think we've heard from the board regarding the crisis.
The reason why you've not heard from the board is that we are working behind the scenes. We've had discussions with the Kenya Medical Association, and the approach we have as a board is that while we say doctors and healthcare workers must be listened to and their dues must be paid, we are also calling for patience, because there are some logistical issues, particularly the government financial cycle, where you get the budget approvals and the money being transferred to the counties. I think that is something that has been explained. It's a big challenge, and the government did explain that they have already fast-tracked the process, and money should not be an issue now. Each county should be able to pay their health workers. But when it comes to promotions, I think that is something that is between the Public Service Commission and the county service board. I think harmony need to be exercised to ensure that the counties do not discriminate against. A particular county does not give benefits that are not being given to other counties. Right. I think we are looking at situations where we have seen some counties are announcing or advertising varied benefits, and we are calling for harmonization. This has to be done in order that any doctor who is working in County A should be able to access the same benefits with a doctor in County B.
All right, so harmonization across the county.
Yes, harmonization.
You mentioned the issue of pay and that is being resolved. However, this is not the first time that doctors, nurses, medical practitioners in general have complained about delayed pay from the counties, and each time the issue of a strike rears its head, we hear of harmonization between the national and the county governments and money being released. In some instances, we've even heard governors saying themselves that even their own pay has not been made. So what can we do to put an end to this crisis?
I think, Yvonne, in the past there was a challenge where we would send interns to the Ministry of Health, and the ministry would say that they don't have allocation, and they would get the interns to delay from reporting to their internship training centers. And what we did with the Ministry of Health was that we did a forecast and gave a prediction and said foreign trained doctors are this number, local doctors, trained doctors are this number, and the ministry did that kind of projection. That is never a challenge as of now. What we are saying is that if, for real, salaries are being delayed for everybody, doctors will have to listen to the real cause of the delay. But somebody should take responsibility. Why would releasing funds to the counties be an issue when the Parliament has passed the budget, the President has assented to the bill, and it's an issue of electronic transfer?
So what has been the role of the board in this crisis? Have you spoken with the national government?
The role of the board, of course, we are in touch with the Ministry of Health, the Ministry of Health, which coordinates healthcare in the country. We've been in touch with the union and the Kenya Medical Association, and we've told them to give us their issues in isolation, that this is a persistent problem, and that one is being addressed. But the much concern that the board has gotten in is where the healthcare workers are asking for health service board. And I think there we stand with them. We feel that just like the Teacher Service Commission addresses issues for teachers,
so a health
it is high time we thought of a health service board where all health workers' issues can be addressed. If the government can transfer the money for the health workers to that commission, that can be done. Apparently, this was not included in the Constitution. And I think there is where we failed, all of us, because we were busy forming commissions to oversee other activities, and we forgot or we overlooked the issue of our health. Health is so important that we needed a commission, and if it needs a referendum, so be it. As a board, we support the Health Service Commission because it can really take the burden off the shoulders of the counties and off the shoulders of even the national ministry, and get the health workers addressed and the issues of promotions, transfers and postings, just like the Teacher Service Commission is doing. Okay. What we asked the doctors, why didn't they say this at Bomas? They gave the excuse that they were busy treating even the
Some
people.
would say the same thing of
yes,
the board.
They say,
why didn't the board, under your leadership, say the same thing at Bomas?
No, we let the doctors be represented because we are a health regulatory authority, an agency of the government. We are not a union, and we thought that KMA would articulate this. But in as much as the doctors were saying what they wanted, there were few. And apparently other interested parties, interest came in, and healthcare workers were not given what they deserved. Now there is a health bill, which is in Parliament. Yes. I don't know which stage it is. That is still addressing some of the issues that the healthcare workers want. But the Health Service Commission is a proposal in the health bill. If that can be done, Yvonne, I think the problem and the crisis that we have would come to an end.
Okay, so let's talk about that for a moment.
Let me finish.
Yes.
The other bit is that in as much as health workers are having challenges, as a board, our appeal is that they should put the patient interest first. Let patients not suffer unnecessarily. If there is something that can be done to help the patients, let the health workers consider.
Okay, all right, and we'll get to devolution in a moment, but because you've mentioned putting the patient first, I think this is something we can talk about, because many of the residents in the various counties who are suffering from the paralysis of services in the health sector say, but doctors took an oath, nurses also took an oath to, look after their patients no matter what, and the fact that they are sort of abandoning their patients, and that is something to worry about.
Yes.
What's the board's position on that?
As a board, we would deal with health practitioners who are brought forth having contributed to the death of a patient. But the human face on this is, if a doctor has not been paid and they have been chased from their house because they have not paid rent, and we are punishing them for not going for work, they have loans to pay. They have children to take to school. Their children have been sent away from school. Would we punish them for not going to report to work, and they've got to negotiate the issue of their children in various schools? So in as much as we are looking at the Hippocratic oath, where doctors have to value life, we also have to look at the human face on it. They still have needs like any other person, and therefore they must be.
All right, Daniel, and what happens to those families who have lost their loved ones as a result of not being tended to during this crisis? What recourse do they have?
I think as a board, we will not take anybody who has lost life during this strike to have been caused by the health worker in person. We will take the responsibility on the institutions, and you look at the role that has been played by various healthcare workers. But we would appeal to healthcare workers to ensure that life is not lost.
But Daniel, you don't see a direct cause and effect between a doctor or a nurse or a health worker not being present. In essence, some would call it negligent to some degree, and a patient losing their lives. Is there no direct cause?
As a board, we are not going to call it negligence until we sit down and hear the case as it's presented. Because as I said, if people have not been paid their salaries and we are telling them go to work, some of them commute. How do they go? That is an issue. But we are calling upon them to exercise care and to put the patient first. If they would do that, I'm sure every situation would be explained. But as a board, we don't want to threaten, to say that we shall do this and that. we would rather investigate and come up with a solution based on what we have found.
So who
and whoever we find is culpable.
The institution, the government?
Yeah, there is the institution.
The Ministry of Health?
We look at the institution. Patients belong to either a doctor or they belong to an institution. Now, if that institution has failed to exercise care to their patients, simply because their employees have not reported for duty, then we shall find which employee was supposed to be there and what circumstances led to the patient losing their life. And that way we'll investigate and make a determination. But doctors, nurses, clinical officers, lab technologists, pharmacists, all know that the life of a patient is dependent on what kind of care they offer. And we will just plead with them. Plead. The word is pleading. I'm not directing. I'm not threatening. Plead with them at this time, these difficult times, to look into the interest of the patient. That is what the board would say. Look into the interest of the patient with a soft heart, and then ensure this situation is contained. And the governors, the county governments, and whoever is responsible for the pay must take responsibility, ensure people, healthcare workers are paid effectively. I mean, I don't understand why there is delay in January, delay in February, and delay in March.
Right. So
yes.
some of these issues that you have been
They
raising,
should not
and
recur.
perhaps
They should not
some
recur.
of those solutions. Okay, we'll get to your conference in just a moment. That takes place next week. That's the 1st to the 4th of September. We're speaking with Daniel Yumbya, who's the CEO of the Kenya Medical Practitioners and Dentists Board, on the health crisis.